From COVID case number 1 3 months ago to more than 47,000 as of this morning, including 1,400 people who have died.
And that's how the pandemic has ravaged Virginia. We know these numbers through the amount of COVID testing, and investigative reporter Chris Horne reveals why Virginia is way behind in his special report, A Test of the System.
Health officials say we won't know the true spread of COVID without more testing, but Virginia ranks 40th or worse among the 50 states. I found that it was a combination of a poor start, a lack of resources at the outset, and some woefully weak links in the supply chain.
We're in the bottom of that list, but it was due to our slow start.
Virginia Health Commissioner Dr. Norman Oliver insists that Virginia has turned a corner.
The absolute numbers of tests that we're doing now is good.
The state needed more testing capacity when COVID cases began to mount. UVA became one of the early partners.
I've never experienced anything like COVID in terms of the demand on the testing.
But you can't conduct COVID tests without COVID test kits. Mathers blames an unhealthy supply chain.
Reliance on one single commercial vendor of COVID tests is not proving to be a sustainable way to go.
And not just test kits, PPE has been hard to get, and even those giant Q-tips they insert up your nose.
I think something as simple as a swab would be easy to get when we're doing this much testing across the country. Those have been very difficult to come across.
Reliance on single sources for supplies, or eventually a vaccine, can have not just public health consequences, but political ones too, according to Senator Mark Warner.
Nothing would be more disastrous than if a vaccination is discovered and suddenly the only source of production is going to be China or somewhere else where we may have some challenging relations.
In addition to UVA, the state health department has partnered with VCU and Centera here in Hampton Roads to get more tests completed more quickly.
I have to commend organizations like Centera, which has done a lot with providing testing in community settings.
Like this testing event last week in Norfolk, an outreach to Hispanic residents that involved coordination from the Hispanic Resource Center. Centera started by processing a few dozen tests a day, but lab director Eric Young saw the curve growing steeper in March and April.
Very quickly, we realized that this was going to be a much bigger issue.
So Centera ordered these machines.
Between the two of them, we can now do about 1,200 per day.
By the end of May, Centera had already processed 30,000 COVID tests. The health commissioner says Virginia is now on a path to more tests and a more accurate picture of the spread of COVID.
We're going to be ramping up and doing much more testing.
We know it's an undercount because we haven't had enough testing available. And I think I'm a fan of more testing.
Warner says COVID testing cries out for a single national program.
To try to have every state set up their own testing regime and compete for the testing equipment, testing sources makes no sense.
Everyone I spoke with says we need to diversify the supply chain for those badly needed testing items. And remember, a COVID test is just a snapshot of your health at the time of the test. And testing in and of itself doesn't protect you from the virus. We have an interactive map on WAVY.com that'll tell you where the testing sites are. Chris Horne, 10 on your side.